I like working at Orlin Cohen. One of the reasons is because it's one of the few groups that allowed me to focus specifically on my subspecialty, which is shoulder and elbow. And they had proven with other partners that you could grow rather quickly and exponentially. And in my first year, I'm already doing 95% shoulder and elbow. What I really like in my specialty is the variety. It's just getting people back to what they like to do in life. And specifically at this group, what's most beneficial is focusing on such a small area. It's enjoyable to be the second or third referral consult and have a patient come to me and finally feel that they got the care that they were looking for. At Orlin Cohen, we do have all the state-of-the-art equipment. Sending my patient to get an MRI and knowing the radiologist is reading it, I trust him. He's going to provide the best interpretation of their image. I have access to that at any time. I have access to him at any time. We can discuss a complicated case and get the best care that a patient needs. I would say there's absolutely a sense of teamwork and camaraderie amongst the physicians. Everyone's looking out for what's best for the patient's care, and no one here is above asking for help. It's actually an enjoyable work environment. I enjoy everyone here. The professional practice management team runs everything. They take care from the billing, from the surgery scheduling, to patient questions, to pharmacy refills. So I can spend all my time not only on the patients that I'm caring for at that very given moment, but on the patients that I'm going to operate on that week. Our relationship with South Nassau Community Hospitals is great. They provide excellent care for our patients. The nursing staff is excellent. There are PAs in-house 24 hours a day that provide comprehensive, excellent care for our patients. Patients constantly state how great our PAs are as well. There's a specific orthopedic floor. Being in such a large group with 30-plus physicians, I'm only on call on the weekends every 6 to 8 weeks, so I have my weekends off. There's always a colleague of mine who's on call. If I have a patient that happens to still be in the hospital over the weekend, I trust them to take care of my patients as well at the hospital. There's great support staff. I see my future at Orlin Cohen just continuing to improve. Shoulder and elbow is a relatively new subspecialty, and it's difficult to get a job in my specific field. And I did 200 cases in my first year, and I'd say 95% of them were specifically shoulder and elbow. And I'm just getting busier and busier.